I'm Dr. Juni Favarin, a plastic surgeon, and today I'm going to talk a little about how to make lips look more beautiful. This is a request that many patients make when they come in for rejuvenation surgery, when they come in for eyelid surgery. And I notice that more and more women are seeking this kind of enhancement. I've noticed that lips are in fashion. So I've brought here the tools that we, as plastic surgeons, have in our arsenal to help our female patients and our male patients too, because why not men, to have more beautiful lips. And I'm going to talk to you about 4 tools that I consider very important and that we can use to perform this type of treatment on patients. The first is fat grafting, which you already know. We're always talking about it. The second is the lip lift, which is super trendy right now. I've seen many professionals, both doctors and non doctors, promoting this on social media. Today, I'm going to share some concepts with you so you can better understand what to expect from this procedure. Bardotization, which is a very old procedure. If I'm not mistaken, its first description dates back to the 1970s. And someone who used to do it a lot was the late Ipitangi, who popularized it at the time. Back in the 70s, this technique was in vogue, and I've noticed it's having a revival. It's coming back into fashion. And the third and fourth, which are also very common requests among patients over 50, are treatments for the so called BART code. So I'm going to talk a little about each of them. Fat grafting, lip lift, barbotage, and the Bartas code. What can we do for our patients? What are the aesthetic measurements of the lips? What are we aiming for? When we're looking to improve a patient's lips, the lips have specific measurements, and these should be respected so that the result looks natural and the lips don't draw more attention than they should. I read a phrase the other day that I thought was really great, and it said the following: when we do a treatment, when we perform plastic surgery, what should draw attention is the patient and not necessarily the plastic surgery she had. In other words, she should look better, she should look more beautiful, but it shouldn't be obvious that she had surgery or a procedure or anything like that. So, the first concept, the upper lip is thinner than the lower lip. Generally, the volume of the upper lip is about 80% of the lower lip. It is shorter and less voluminous. This is the first concept I want you to understand. Okay? And the second concept that I find very interesting is about the proportion of the lips. The upper lip is generally more projected than the lower lip, but this projection can't be too exaggerated. When it becomes more than 1.5 times or 1.6 times, it starts to look like those duckbill alterations. The 1.6 proportion is what we call the golden ratio. If we start calculating proportions on the face, on the lips, the eyes, the eyelids, all of them derive from this 1.6 proportion, which is nothing more than the Fibonacci sequence. So anyone who likes to read about this, about verification, has probably already come across these things on the internet. So let's get to what matters. I've brought here a photo of a lip. It's the typical lip we find in a 50-year-old woman. It's that kind of lip that has lost a bit of volume. It still has good definition, but the anatomical structures aren't very visible. There's a very noticeable barcode, and the volume is still okay in this patient. So when we treat a patient like this, we usually make use of nanofat to improve skin quality, fat grafting to provide more appropriate volumization, and we reconstruct the anatomical structures of the lip. Usually, these are the Cupid's bow, which is this shape here, this notch we have on the upper lip, and the philtral columns, which are those vertical little columns. And we can also achieve this with fat grafting. Another anatomical detail that I find very beautiful and that brings a natural look to the result is contouring the patient's lips. This is also really great, and we can also do it with fat. So, with fat grafting, we can do almost everything. We can enhance the volume, we can improve the barcode lines, and we can shape the structures, the anatomical structures, and we can highlight the lip contour. So it's a tool that can be used on its own or combined with other procedures such as lip lifting and bardodization. When we want to increase the vermilion, the dry vermilion, which is the part where we apply lipstick. So when we want to increase the volume of the vermilion, which is that part of the lip where we put on lipstick, we can perform these procedures, both the lip lift and the bardotization. And what is the difference between them? When I do a lip lift, I increase the exposure of the teeth. So when I make this movement, I increase the exposure. So if we want this increased exposure, if the patient has an increased height, that distance between the base of the nose and the lip, it's really worth doing a lip lift. And when the patient has that horizontal smile wrinkle, in my opinion, a horizontal smile wrinkle is a clear indication of lipiditis. What about bardotization? Bardotization is when we just want to increase the volume of the dry vermilion, but not necessarily increase the exposure of the teeth. So basically for us, this is how we recommend one technique and how we recommend the other. And now I'm going to explain a little bit to you about what each of these surgeries is. This here is an image of a lip lift. This is more or less how we draw it. There are variations. There are some calculations, right? The more skin we remove, the more we expose the teeth and the more we invert the lip. One detail that's very important, right? Something I always teach to colleagues or when people come here for courses is that we can't let the skin tension be anchored to the skin itself. The tension, the traction always has to be anchored in a deeper plane. If you leave this skin tense and anchor that tension to the skin, the scar might not end up looking as aesthetically pleasing. And a very important detail when we're doing this type of procedure is that the lip lift can lift the corners of the mouth. So if the patient only has a loss of volume in the central region, that's fine. It's an excellent indication. If she also has drooping at the lateral corners of the mouth, it's an excellent indication for a canthoplasty. So usually when the patient has drooping at the lateral corners, we combine the lip lift with this small procedure to elevate the corner. So as you can see, rejuvenating or improving lips involves several steps. It seems like something simple, right? It seems like it's something we don't need to think much about to do, but you always have to observe the anatomy, always pay attention to the proportions. And what's beautiful and natural is to treat not just the volume of the lip, but all the structures around it. It's just like when we operate on a breast or when we operate on an eyelid. It's not enough to just remove the excess skin. It's not enough to just lift. The contour of the structure also has to be compatible with the new appearance of the lip. So when an older patient comes to me looking to improve her lips or to have facial surgery, we need to improve the quality of the skin, address the fine wrinkles, enhance the contour of the lips, and only then assess whether she needs to increase the amount of the red part of the lips or if she needs to add volume to that red area we've enhanced. So there is a sequence of steps to analyze the lips so we can determine what is best. Treatment and what is the best option for that particular patient. And then there are those younger patients who haven't lost the red part of the lips yet, who don't have barcode lines, and who will really benefit just from an increase in volume, as long as it stays within the proper proportions for the lips. So the lower lip is generally more or less aligned with the projection of the chin. And the upper lip needs to be a little more projected and have a bit more volume. So those were, let's say, my thoughts on lip surgery. And I believe that all patients should be aware of these things when they're going to have a procedure, when they want to undergo a procedure to improve their lips. And there are several tools, there are many options, there isn't just one solution. And which tools we will combine, again, will depend on the indication, the age group, the quality of the skin, the volume, and so on, and on the patient's expectations regarding the procedure. I really enjoy talking about these topics that relate to anatomy, that relate to the proportions of the face and its structures, because it helps patients visualize what we see when we perform the surgery. And that's it, everyone. And next week, I'll bring another topic also related to facial rejuvenation. So we can talk about it, all right? Have a great week, everyone, and see you next Monday. Bye.